The Basic Healthcare Provision Fund is a federal and state-funded initiative. It is a key component of the National Health Act 2014 and has the objective of ensuring the provision of basic minimum health package for Nigerians, strengthening the primary healthcare system and providing emergency medical treatment. It is derived from a minimum of 1% of the federal government consolidated revenue fund at the primary healthcare centers. Those enrolled in the Basic Healthcare Provision Fund are covered to receive antenatal care, delivery and postnatal care for pregnant women, as well as immunizations and treatment for malaria, pneumonia, measles, and dysentery for children under 5. Nevertheless, lack of knowledge of such fund among majority of citizens and its purpose makes it easy for diversion or mismanagement. Head of Barwa Primary Healthcare Center Wushishi, Danteni, said she had been directed not to speak with the media. Nevertheless, she said her clinic has 500 enrollees to benefit from the fund, but could not provide more detail whether the target beneficiaries enjoying the free healthcare services as expected. The district head of Wushishi, Abubakar Wushishi, who is also the chairman, World Health Committee, Barwa Primary Healthcare Center, said the fund has not been judiciously utilized in the last 5 years.
This clinic, Barwa Basic Healthcare, they used to bring 300,000 naira every month. In that 300,000 naira, 200,000 naira is mainly for drugs. Mainly 200,000 naira is mainly for drugs. Then the remaining 100,000 naira, like at least 60 or 70,000 naira will be on this the issue of if the maintenance, if there is any maintenance or in the clinic about this Omo, sanitizer or something, then the remaining 30,000 naira is in respect of the committee, that is the World Health Development Committee. They are the one sitting that every month we have to sit down and deliberate on what is going to do, what are we going to do on that very month with the money. So that 30,000 naira, it is in that 30,000 naira that is the money for committee. They say there is money for this MIE, that is monitoring evaluation. There is money for director, this and this and this, in the remaining 30,000 naira. That is how it is.
The Dagachi gave me letter in order to intervene. So my Oga wasn't stay around, he went to Abuja. The only thing I spoke to my Oga, the council chairman, that Dagachi has given me letter to give you about what is happening in this primary healthcare. He now say I should keep the letter. He will look for me because
the chairman have not seen the letter.
Yeah, he has not seen the letter.
Surprisingly, the primary care center that ought to have been busy on a Monday was found to be empty, except the staff who were seen sitting in the wards.
I don't know the benefit of building this primary healthcare center in your community because I took a patient suffering from malaria to this clinic for treatment. They charged me 6,000 naira. Since then, I stopped my family from coming to this primary healthcare center. My wife was in labor and I wasn't around. She was brought to this clinic because it is closer to my house. She was delivered. They charged me exorbitantly. There is no difference between this primary healthcare center and a private clinic. Around 5 p.m. recently, a car was brought here, packing drugs out of the clinic. We wanted to confront them, but our headers asked us to leave them. Now it is in the night that they do come to pack drugs on bikes. We thought this primary healthcare center was built for the community, but there is no benefit. We were made to understand that if we bring our pregnant women here, they will give us drugs free, but that is not the case. I brought my wife here for antenatal care. For the first time, they charged me 3,000 naira. For the second time, they charged me 4,800 naira. Yet, I had to buy the drugs they prescribe outside.
Community leaders also alleged that employment racketeering has led to employment of unqualified staff in the clinic. Staff in charge of pharmacy department, who was found to be a secondary certificate holder, declined comment, but the superior, Danteni, confirmed his qualification. Niger State Commissioner for Primary Health Care, Ibrahim Dengana, said the ministry took the matter and any other allegation seriously. He said in line With the statutory oversight functions of the Ministry for Primary Health Care, an investigative panel had been set up with a view to ascertain the facts and otherwise of the complaints and allegations. He said the ministry will make the findings of the investigative panel public in due course. Abubakar, Akote, Trust TV News, Minna.